the elderly coming to the VWOs already facing tremendous fee pressure. And to add on the 7%, that will even be more difficult. So at the end of the day, in fact, quite a number of VW then absorb the GST themselves just to ensure that they have sufficient takeout for people coming to the center. But it's a chicken and egg situation because you are short of fund and you want to go to the public to raise funds, but you have this GST, you have to absorb the GST again. So you see whether it's becoming really a big challenge in fact for VWO.
Just a clarification, you mentioned waiver of GST. I hear you on the cost component there, but are there any other specific areas within VWO organization and operations that could be more targeted, assuming that because GST has always been, there's philosophical discussions around whether GST should be waived or not. What other more targeted measures could be given to VWOs to assist in the cost component that you're mentioning, especially for the larger ones?
Quite a lot, actually. Obviously, the staff cost is also the key component because you have to engage qualified people if you are providing particularly healthcare services. And VW obviously cannot match the kind of salary that you pay to this kind of staff. You cannot match the government-owned entities. So whether some form of subsidies can be considered, so at least they have a fair chance to succeed also, and a fair chance or ability to engage qualified people. Because
rebates or grants for employment of qualified professionals, whether it's accounting or management, I think that will help the VWs, or it certainly help them, increase transparency and so on.
Many VWOs still holds the view that it is wrong to pay market rate for the salaries. So you hire social workers, but you say, because I'm a charity, sorry, I'm not going to pay you market rate. As a result, they always have problem retaining staff, and most of them will leave soon to become a HR manager in the commercial sector and it's time we look at the social service sector and pay all the professional staff what they're entitled to.
Funding has been given to industry as well as VWOs, but the question and the concern that most of the time comes across is that too many schemes? Is it impactful enough? Is it achieving the outcome?
Many VWOs come to us and come to NCSS asking for help. And a lot of times, yes, it's dollars and cents. What we have been trying to do was to equate the social worker's salary up to a level that we think could motivate them or drive them. Then when you make a comparison, it's fair. It's a fair wage. So for example, a social worker, we now look at the highest paid social worker in Singapore and who they are. They are from the medical side. So we try to lift and set a benchmark for all the social workers to be up to that kind of level. That's why I take the point, and I do accept Gerard's point that we should pay. Is it market wage or fair wage? Because I think market wage, then you end up competing. But for someone to step forward and do this full time, there's more than just dollars and cents that motivates them. But I think we need to pay a fair wage. What does it translate to the policies and budget policy today? Is there something that we can do for VWOs? What kind of subsidies? In what areas? Facility, rental, wages of course, operations, what aspect? I think if you are specific enough, I believe they can all be recommended or considered.